And so I'm so glad that you were able to join us, and it is my great honor to share in the first of our series, kicking off this series called Live Fierce St. Louis, one of my favorite terms, to kick off American Heart Month. Join us for this entire series, but together we are going to talk about some great community solutions, and we have a host of panelists that you will absolutely love and find value, I'm certain. Our goals are to share the American Heart Association's commitment to equitable health for all of us. We want to also learn how the community is addressing some of the key drivers of the health disparities that we see. And we also want to look to the future to truly achieve equitable health and well-being for all, not just in our region, but everywhere. Our guests today are Gerald E. Johnson II. He's the Executive Vice President, Health Equity and Chief Diversity Officer of the American Heart Association. We will also have Denise Hooks Anderson, one of my favorite MDs, who is the Associate Professor as she's an associate professor, and family and community medicine is her focus, the interim assistant dean of diversity, equity, and inclusion, and is with the St. Louis University School of Medicine. We have Sharonica Hardin Bartley. Hardin Bartley is with the School District of University City. She is in the office of the superintendent, and we also have Kristen Wild, who is the executive director of Operation Food Search. So we should be able to put together and share extensively and in this conversation about what the options are, what our hope is, and how we might all be a part of the change that we are hoping to see. How's that sound? Excellent. Let me just pull up these extra notes here. Perfect. Heart disease is the number one killer of all Americans, and stroke is the leading cause of disability. As frightening as that sounds, the risks of getting those diseases are even higher for African Americans and the Latinx communities. We'll hear about the latest science and data and the American Heart Association's new 2024 impact goal that builds on decades-long work to address those barriers in health equity. So thank you again for having us. So how do we achieve health equity? Well, it's achieved, first of all, if all people have the same opportunity to be healthy. As a longtime resident of St. Louis, I have seen firsthand the health barriers that directly affect so many of us and our neighbors in the region. Addressing these drivers of health is the only way to truly achieve equitable health outcomes and well-being for all. So let's take a deeper look at the factors such as race, our environment, access to healthcare, access to adequate and appropriate nutrition, educational opportunities, and income level. All of these are significant barriers to optimal and equitable health. So while there's much work to do in addressing and even removing barriers in health, it is in our most vulnerable communities. We'll start today by igniting this important conversation. Today's conversation is the first in our series, and I'd like to take this opportunity to thank our sponsors of our communication today, BJC Healthcare and the Missouri Department of Health and Senior Services. Thank you. I want to first introduce you to one of our esteemed panelists, and that's Gerald Johnson, as I mentioned before, Executive Vice President for the Office of Health Equity. I don't know why that screen popped up. Pardon me, everyone. For the Office of Health Equity and the Chief Diversity Officer for the American Heart Association. Gerald, welcome.
And Jay, thank you. Good afternoon.
It is really great to see you again, sir, especially now in this time. We need you. Can you help us lay the foundation and get us started on the topic of health equity, since this is your area? What has the association's journey to health equity been, and what is the American Heart Association's commitment to achieving health equity for all?
Yeah, Jay, thank you. And good afternoon. And thank you to the sponsors for creating an event where the AHA can share the great work that we're doing in the St. Louis market and around the world. I mean, I think for us, it starts with that definition of health equity making sure that everybody's clear on what we mean when we say health equity. And as a reminder for folks, when the AHA is talking about health equity, we are actually talking about the belief that everyone deserves a just and optimal opportunity to be healthy. We are paying a special attention to those who are at the greatest risk, and that we also want to make sure that nobody is disadvantaged because of their social position or any other circumstances that may be defined for them. And so if you think about one's race or one's place or one's differences, none of those things should be the reasons why any of us or none of us can't live and have the best of health. And so by definition, that is what we mean when we talk about health equity as an organization. We stay centered on that belief that everyone deserves a just and optimal opportunity. And from there, it's all about the science. I see you have up our 2024 goal, and the spirit of that is making sure that now that we're clear about what we mean when we talk about health equity, well, what does the AHA want to stand for? We want to champion health equity in all its forms. We want to make sure that when you think about cardiovascular health or stroke, when you think about the barriers that get in the way of one being able to have optimal health. I mean, you heard Jade mention earlier, one's environment. We talked about education. We talk about housing. We talk about neighborhood. All of those things are critically important. And we also know that we also have to address the structural issues, better known as structural racism, and how it shows up in getting in the way by way of laws and systems and things that work together to disadvantage people of different races. And so for the AHA, science is at the center of everything. Science is telling us that while we've talked about being an education organization and why we've also evolved to talking about the risk factors and the acute events, we know that the mortality rates and the incidence for cardiovascular disease and stroke for populations of color, in particular African Americans and Hispanics and Native Americans, are still higher than they need to be. And so what else is behind that? What else should we be thinking about? And so evolving from risk factors to also address the social determinants of health. Again, as a reminder, it's our environments. It's where we live and play. It's all of those things, but it's also the distribution of money, power, and resources. And so you can't think about one's health and one's well-being unless you account for those things as well. And then in doing that work, the science is also leading us to recognize that the structural barriers, the very systems, the very laws, the very customs that exist, that get in the way of people of all races being able to be as healthy as everyone else, has to be addressed. And so that's where the AHA is. We are recognizing that, yes, education is important. Yes, focus on acute factors are important. Yes, addressing risk factors are important. Addressing social determinants of health are important. But the science has also led us to recognize that unless we address the barriers, the systems, and structural racism in particular, we will not be successful in addressing our 2024 goal. Thank you, Jade.
Gerald, that's a dynamic answer. And what an undertaking that sounds like it will be. But when it comes down to science, we're talking about the facts, and that should help lead and guide the way. I look forward to the questions we'll be able to share with you as we go forward on this. Thank you so much. Well, that gives us a great foundation for the discussion. And thank you for your leadership, I meant to say. I know we'll have more questions later on, but I want to take a moment to introduce our next panelist, and that's Dr. Denise Hooks Anderson. Dr. Denise Hooks Anderson is an associate professor of family and community medicine and is the interim assistant dean of diversity, equity, and inclusion with St. Louis University School of Medicine. Dr. Hooks Anderson also serves as the board president for American Heart Association Metro St. Louis Board of Directors. Welcome to you, Dr. Denise Hooks Anderson.
Good afternoon. Good to see you again, Jade. You're always doing such great work for our community. Thank you.
Thank you for only mentioning that, and not that I'm not taking as good care of my health as I should. But this is why we do the work in the areas of where we all need it most. So I'm very convicted. But as a family physician, you undoubtedly see the effects of poor health every day. From your perspective, what are the primary drivers to poor health in our region?
There's several issues. And thank you to Mr. Johnson for mentioning many of those. Social determinants of health are huge components of poor health. Um, Lack of access to insurance is still a problem. Many people still have their insurance policies connected with their jobs. And if they lose their jobs, they lose their health insurance. And oftentimes, even if they have a job that offers health insurance, the premiums are too high for them to even consider keeping those plans. Because if they have a family, it's just difficult for them to be able to pay those type of premiums. So you still have a good chunk of people out there that may not have access to adequate care. And what does that mean? So if you don't have access to adequate care, you're not coming in for preventative visits. That's a luxury. If you're hearing all of these screenings out there that you need to have your cholesterol checked on a regular basis, you need to go in and see your doctor once a year for a physical, to have your blood pressure checked. Well, that's difficult if you don't have insurance to pay that out of pocket. So again, that's a luxury. And if you're not coming in to get that done, you don't know that you have diabetes. You don't know that your blood pressure is 200 over 120. And so what do you have available to you is having to go to an ER for things that could have been taken care of in your doctor's office. So that's a huge issue, that lack of access. I think health literacy is also a huge problem because a lot of times people just don't understand their health. They don't understand the things that they need to do to be better and to improve their health. We think that we're doing a great job by, having access, to all of these, fancy computer programs, or, telling people, oh, go to this website. All that's fine and dandy if you have a computer or if you have internet access at home. And I think that point was brought home during COVID when everyone got sent home, those that could go home. And we just said to them, oh, you know what? We can do virtual visits during this time. Well, we didn't think that even if a person did have internet access at home, it wasn't good internet access. It was really slow. And so these type of platforms were not available to them. So we have to always think when we're coming up with ideas, when we're saying that this would be good for this population, how do we make that accessible to everybody? Because not everyone has that capability. So health literacy, lack of access to insurance, just poor nutrition. And I'm glad we have someone on today that will talk a little bit about that. And so not just access to food, what to do with the food that you do have. So many times when I'm having conversations with my young mothers, when I ask them, hey, so what are you preparing for your kids? What they have access to is not necessarily what's best for them and their kids. Because what's inexpensive is something like, the cheap packets of ramen noodles. And you take those inexpensive packets of ramen noodles and you chop up hot dogs. And for many families, that's their meal. And so having to, explain to them, well, these are the type of nutrients that your kids need. So again, that health literacy, that access to really good food, to even understand that these are the building blocks that your children need to be successful in school, as Dr. Harden will talk about later. So all of these things are connected. And so I'm glad we're having this conversation with the American Heart Association to put the pieces together to see how we can improve the health of our communities.
Absolutely. And the fact that they do go together and they're a part of a fully functioning system is so key. And I'm really excited that we're starting to bring those all into the same dialogue. Now with COVID, how have you had to pivot in the COVID-19 environment?
you know, how I like to say it is, what a whammy. 2020 was beyond words, just beyond words. So it was just an interesting transition. So like everyone, everyone was, you know, kicked out of the office initially until we can kind of put our heads together to figure out how do we do this. And prior to 2020, getting insurers to cover virtual visits was a headache. And they just really didn't want to do it, or it was not covered very well. But because of COVID, that was a necessity because patients were not wanting to leave their homes to come to a doctor's office to be exposed to potentially COVID. So, you know, doctors started doing virtual visits, and so our office did as well. And so again, as I stated earlier, not everyone has access to internet at home. And you would think in 2020, in this century, that everyone has that, but they don't. And if they did, it's not good service. It's not fast enough to be able to conduct that type of visit. So we did telephone visits. We did the video visits if we could. We also had to, you know, just explain to patients about COVID as best we could. Because the other thing that we found was that once this started, they didn't want to go to the ER for anything, even if it truly was an emergency. If they were having heart pain or chest pain or shortness of breath, they would call our office and we would say, hey, you need to go to the ER. But they would refuse, saying that they were too terrified to even go. So what you found during that time, you had less people getting their cardiac catheterizations that they needed. You had less people going to the ER for obvious stroke-like symptoms. And that was actually pretty dangerous. And so we had to start doing a campaign to say, hey, if you have these symptoms, you truly need to go to the ER, and to talk about all the safety precautions that were there in the hospital. So that pivot was pretty intense for most physicians. And then as, you know, we kind of got our bearings and we could figure out how to keep our staff safe, our providers safe, and the patients safe, you know, we then started slowly opening up our offices again. And for many offices, the plan had been, you know, if you have obvious sick symptoms, you know, please do virtual visits, and all other people were coming into the office. But for a while, you just couldn't get people to come in because they just refused. And so again, lots of education. And even now, the fact that we're in the process of the COVID vaccine rollout, there's so much education that we have to do a better job as health providers, as service organizations, to make sure that that no one is left behind, that we're reaching every corner of our societies, and that they have equal access to the information, to the vaccine, to whatever technology we have to do a better job of making sure that we can reach every corner.
Thank you, Dr. Hooks Anderson. I've been hearing more about community education through community ambassadors, and by educating community members that can then take the education to maybe 10, 20 of the folks that they know and partner with our organizations and institutions in order to help one make connection to that information, but a connection to the resources and help we need. What do you think we should be doing as a community, or where we should be keying our focus, since there are so many areas that need attention?
No, I think those are great ideas. I mean, peer leadership, peer support. We know that in a lot of different avenues in healthcare, we know that works as it relates to like breast cancer and other types of health conditions. So getting those people out in the community with good, sound scientific information is important. And so whatever we can do as a service organization or as a provider, we should be trying to assist them in that manner. Because again, but people are getting just bad information. And if we can combat that with our information, Working with our legislators, as Mr. Johnson talked about, these systemic and structural problems that are there, addressing those. You need ambassadors for that. You need people who are going to hold legislators to the fire to make sure that our communities are equally represented. That legislative advocacy, peer advocacy, your healthcare advocacy, you need all of these channels to improve the health of your community.
Thank you so much, Dr. Hooks Anderson, and thank you for all you do on the front lines of healthcare, especially in this pandemic. So appreciative, and certainly have more questions there. Well, our next panelist is with Ms. Kristen Wild, Executive Director with Operation Food Search, one of my favorite organizations. Boy, they've been working. Operation Food Search is a St. Louis-based nonprofit organization dedicated to ending hunger in the greater St. Louis metropolitan area. They are a major distributor of free food in the bi-state region. Kristen, thank you for being here today.
You're welcome. Thank you.
Yes.
Wonderful to be here.
Say again?
It's wonderful to be here with these esteemed co-panelists.
Including yourself, Kristen. We all know there's a direct link to good health and proper nutrition. Share with us the state of nutrition security in our region. How bad is it? Where are things? What are our neighbors and families experiencing today related to hunger and access to proper nutrition?
Unfortunately, the situation was not good before the pandemic, and it has become worse in the last year. We're currently looking at, in the St. Louis region, a food insecurity rate of about 18.2%, which is an increase of about 25% since 2018. And for kids, it's even worse. About 1 in every 4 kids in the St. Louis region is food insecure. And that's an increase of 42% compared with 2018 levels. And part of that is due to the fact that, a lot of schools have had closures, and a lot of kids who are heavily reliant on free and reduced meals at school don't have the same access. The schools have done a phenomenal job of making food as available as possible. But for some parents, it doesn't work out transportation wise to go pick them up, or the timing doesn't work. So that's why the pandemic has really hit kids very hard. There's a lot of families who are experiencing food insecurity for the very first time. It was always something that, someone else maybe dealt with, but they're, due to job losses and challenges with the economy, they're having to make those choices between whether they're putting food on the table, or they're paying their utility bills, or accessing healthcare.
One of the key ways that you have been able to make impact is by being able to do outreach. And you combined your outreach. You were a helper to literacy and other services. It was a beacon. COVID certainly had to have affected the way you are able to respond to what was already a tremendous need to what is amplified even more today. However, do you pivot in the COVID-19 reality, and maybe even how can we help?
Yeah, there are a variety of ways that we've had to pivot. There are a lot of disruptions to the food supply chain. So some of our regular food donors were not able to donate at the same level. Organizations that would host food drives for us were closed. So we've found new partnerships and new sources of food. We've been fortunate to take advantage of the USDA's Farmers to Family Food Box program, which is now in its 5th stage since the pandemic. And we've actually distributed about 85,000 boxes of produce and dairy and meat products that are, really high quality. We actually kicked off a gleaning program that was planned pre-pandemic. But yes, we're out there at local farms harvesting food that would have otherwise gone wasted. So we're really excited about that. We've got expansion plans for 2021, and we have team members and volunteers who go out, and they'll pick strawberries or lettuce or whatever it is that the farm has that they're not, selling to the stores or restaurants or wholesalers. And then we are able to save that, rescue it, and distribute it to our partners. So we've done a lot of pivoting with our, food distribution. We've actually purchased quite a bit more food than we normally do because donations are down. And fortunately, the community has been very supportive and helped to support those food drives and fund drives that we've been hosting. And then we've also struck up a lot of new partnerships or strengthened existing ones so that we can conduct these large scale drive-through food distributions. You may have seen some on the news. We've partnered with Urban League, with Catholic Charities, Beyond Housing, and that's something that's been different than our traditional model of food distribution, but it's been really essential during the pandemic. And we've done a lot of partnering with school districts and libraries and other community organizations to also conduct these drive-through models so that we can get student meals and emergency food kits and produce boxes into the hands of families.
Wow. I have to applaud the innovation, how very creative, and to not let things go to waste or the wayside with what you described as some of the initiatives you've taken. And I also would like to applaud one I learned about, and that's your work with media like the Nine Network, so that people know where to go to get the food they need. And we mentioned earlier, I wonder what may be on the horizon for helping people once they get the food to know how it benefits them, as well as how to use and prepare it in the most effective and, hey, how about tasty way, beneficial way.
Yes, yes. Well, and we're all about meeting the immediate need, but we like to go beyond that to really provide innovative and long-term solutions so that people don't have to, just pick up food from their local pantry, but they know best how to stretch that food, and they know better how to utilize the food that they're purchasing. So we have a whole nutrition education team that's dedicated to providing cooking classes, nutrition education. We even do grocery store tours to teach people how to shop for, the most economical ingredients that are nutrient dense and provide the, most nutritious meals that they can for their families. And we have a big nutrition education component in a program that I am just really excited about, which is our Fresh RX Nourishing Healthy Starts program. And that program is specifically targeted at pregnant women who are identified as food insecure. And in our first 75 babies that have been born in the program, we've had a substantially reduced low birth weight and low birth rate, and preterm rate. And when we look at those 75 babies who've been born, we've actually had a 5.3% decrease in that low birth weight. And that translates to a savings of about $189,000 in Medicaid costs. So we're working with families, we're providing them with weekly family meal kits, the nutrition education, case management. We help enroll them in safety net programs if they're not already enrolled. And we're working now, we're launching a program where we're going to be enrolling about 750 families. And we're working with the 3 Medicaid providers in Missouri and the Social Policy Institute at WashU to do a study to prove that food should be a reimbursable healthcare expense. So
food as a reimbursable healthcare, but food as medicine, that's novel.
Medicine, yeah.
I say we give it a try, but you're going to make a lot of people happy with what you said is on the horizon, Kristen. Thank you so much. You've really painted a great picture of the problem that we were unaware of, and some of the solutions that we can look for and get involved in. Please extend our thanks to your team and the great work that you all are doing for the community.
Thank you, Jade.
You're the best. I'd like to bring in our last panelist, and that's Dr. Sharonica Hardin Bartley, Superintendent of the School District of University City. Dr. Hardin Bartley is an outspoken advocate for equity, trauma-informed practices, and student voice in education, and serves as an American Heart Association board member of the Metro St. Louis Board of Directors. Welcome, Dr. Hardin Bartley.
Very happy to be here. Thank you, Jade.
Well, what are our young people telling you that they're dealing with today? Because it has to be tremendous. And coronavirus has affected some more than others, but if they're talking to you, help us understand what they're dealing with, or what you may even observe if they don't tell you.
Well, I want to thank the American Heart Association for creating this space to engage in dialogue regarding such an important topic. Our children are not well holistically. And I think that many of the challenges that we saw from an equity perspective pre-COVID have just been expanded even more. So lack of connection, not being able to go in person into schools, mental health is increasing significantly, food insecurity, what we just talked about, the trauma that is associated with loss. Many African-American families, and my district is 87% African-American, have been disproportionately impacted due to COVID. And so we are experiencing those issues that are happening in the home, in the community, that we can't insulate from the school building. So this is a very difficult time for young people. We're still seeing them be resilient and persevering despite the current circumstance, but we really are going to have to think differently as a region, as a nation, about how we embrace our young people, particularly those who are the most vulnerable. COVID has really just opened up and exposed, again, many of the inequities that have plagued our system, our public school system, our healthcare system for many, many years. So it's going to take a cohesive, collaborative approach to address those issues.
So I'm going to ask you this personally. Do you believe it can happen?
I believe, yes, I have to have hope.
We have to have hope.
And I serve as children, so I have to have hope. I think that the reality is we have the resources. We know the answers. It requires more coordination. It requires more communication, and it requires more education. I think that St. Louis is resource rich. We unfortunately work in very fragmented ways. And so we have not developed this cohesive organic process of providing supports. But I'm going to say, yes, Jay, we can do it. And I'm going to say we must do it. Our children are waiting on us, so we must do it.
Bravo. And it was kind of a softball question and trick, because I wanted to hear you say it, because I know you know how to rally our excitement and determination in this area, which is why I'm so glad you're part of this conversation, and a necessary part of this conversation, because you can help us understand the connection between equitable education as well as equitable health. What is the connection there?
They're connected. There's no separation. We talk a lot about, are the children well, here in UCity, and wellness is physical, mental health, as well as the academic and social emotional health of students. The ACEs study gave us a clear adverse childhood experiences study, gave us a clear picture of the adversities that children face as well as adults. And we see that impact having been very significant in the context of schooling. So when you have food insecurity, when you have job loss, when you have housing insecurity, you don't know where you're going to live day to day, those things definitely impact not just the person, it impacts the brain, it impacts how our children think. And what we're learning more about, it also impacts life expectancy. So these are real issues that need to be grappled with. And when we see children show up at our doors ready to learn or not ready to learn, schools have to really be thoughtful and innovative and ask questions about what is happening. We're changing our questions. Instead of saying what's wrong with you, what has happened to you? What are the resources that you need? What are the supports that we need to provide? There's nothing wrong with our children. There's nothing wrong with their brains. We have to focus and support them differently. And so I see schools, yes, we're educational institutions, but I also have to engage parents in dialogue about healthy food habits. I have to work with my community about healthy choices so that our students have access to that. We have to talk about about obesity. We have to talk about heart disease. We have to engage and educate children and their parents around these conversations and not assume that they just know that eating McDonald's every day is not a healthy option, even if you get the apple slices and not the fries. So we have to be more informed. I was a single parent when I was raising my son, and McDonald's was my quick route, and it was the thing that I had to do. We understand that, but how do we provide other options for that parent who's moving and needs to get from point A to point B so that they can do what's best for their children? No parent wants to not provide what's best for their child, not a one. They do the best that they absolutely can. And so without judgment, we have to be able to engage them and share those resources. But I don't separate the physical mental health from the academic. If children are not well physically and mentally, we can't expect for positive outcomes academically. They go hand in hand.
Absolutely. And there's so many components, and that's really tied to this trauma-informed practice and that you are leading with there in U City. I just want to touch on that a little bit for anyone who may not know. Could you please explain in maybe like 30 seconds the sum up of trauma-informed practices, why you're using it, and why you think other people should?
In 30 seconds, okay.
Yep, you get 10 seconds per component, 10 seconds.
Okay, it is the root of our humanized pillar. We have 3 pillars in our district. One of our strategic priorities is well-being and joy. And it's what I said, it's a head and heart business. If our children are not well, if they're not whole, we can't expect for them to show up and thrive, not survive, but thrive in our schools. So we really embrace understanding the ACEs study. We understand how those adverse childhood experiences show up in our classroom. We have looked at restorative practices as a way of engaging students in discipline. And it's also about adults. We have teachers who are on the front line, and we have to make sure they're well too. So we talk a lot about self-care for our teachers, the educators who are caring for our children. So that is a 30-second soundbite of the 4 years of work we've been doing around trauma-informed practices.
And you did that even though I knew you would be up to the challenge, and brought it on home with complete and total grace. Thank you so much, Dr. Hardin, for your dedication to our young people. And thank you to all our educators who are definitely the heroes, some of the heroes during this pandemic. So I'd like to move into a broader discussion with all of our panelists. During this discussion, I encourage our viewers to leave their questions in the chat room, the chat box below. We'll try to answer as many as we can in the remaining time, and we've received a few already, so I'll start with a couple of those while we monitor the chat box. Gerald, I'll start with you. So what now? The American Heart Association has our attention. They know what things to put into action and to make meaningful change toward achieving equitable health for all. Where do we start? What needs to change for us to realize it? Give me a call to action.
I think that the first thing that we're recognizing is that there's no one solution. And if you think about all of the comments that the great panelists have talked about today, it runs the gamut from access to care, to being able to afford the co-pays and the prescriptions of the care, the transportation to get to the care. It talks about the environments in which we live in. And so the role for advocacy, when you think about policies, when you think about those kinds of things, if you think about livable wages, I mean, part of the issue here is livable wages and education. And then I think an issue that also gets talked about but often overlooked is the fact that no one organization can do this alone. And so one of the things that the American Heart Association is really championing is this notion of us and allyship, because it's going to take all of us to lean in. But specifically where to start? Barriers. If you think about what we have been saying, if you think about what our Presidential Advisory on Structural Racism has told us, is that yes, all the other things need to continue to be addressed. But if you don't address the fundamental barriers, which happen to do with how money, power, and resources and policies and laws are practiced, you will not change the trajectory of the things that we're experiencing. And so an example of that is around toxic stress. And if you think about something that happens every single day because of the color of your skin or the location you live in and or the size of your wallet, and it happens every day. Imagine what that does to cardiovascular health. Imagine what that does to brain health. Imagine if every night you're wondering where you're going to sleep, but yet when you finally get to school, you realize that it's a warm building and you get a meal. And so what is the first thing you do when you get a warm place and you get something in your belly? You want to go to sleep. It's not that most of these kids aren't interested in school. What we don't understand is their journey getting there. And so I say all that to say that for us, it is comprehensively looking at the whole person. It's looking at the role that advocacy can play, that science can play, that partnerships can play, all led by science, and calling it what it is. You can't address what you don't call out. And so calling it out for what it is and unpacking all the layers of it, and then asking yourself, what are you going to do to address it? And so that's what we're doing. It's the resources that we're going to provide, the partners we're going to work with, the issues we're going to take up from a policy perspective, and using our brand to make sure that we're championing all the good, but also figure out how to leverage our brand to bring others along who may not be ready yet.
I want to stand up and applaud right now. Yes, yes, and yes, to tear those barriers down. Let's go with Dr. Hooks Anderson, for you to chime in on the same question. Do you want me to repeat it?
Please.
Okay, what needs to change? Gerald talked about barriers, pulling those down. What now? What needs to be put into action to make meaningful change? Something we could do. You could even look around this Zoom room. You know, if I were to point out, hey, if I called Sharonica, if I called Gerald and Kristen, we probably could make something happen. What do you think?
So Mr. Johnson mentioned something that's really important to me, is like when he said calling it out. So when you're talking about health disparities, there are times when it doesn't even matter how much money you have, how much education you have. The outcomes are still poor in certain minority groups and certain ethnicities due to structural and systemic racism and bias and discrimination. And we know that from the literature. And so we have to call that out. We have to make sure that our health systems are addressing bias and discrimination in everything that they do, in every aspect of it. You know, we need more people in healthcare to look like our communities. And that's going to take a concerted, intentional effort. And it starts at Dr. Hardin-Bartley's level. So we have to make sure that our babies are healthy, physically, mentally, and spiritually, so that they can go through the different avenues so that they can get into these professional programs to then become these nurses and doctors and ultrasonographers and people that we need in the hospital settings. So, you know, again, we cannot stress enough that we're all connected. Every person that's represented as a panelist on this call, what they do is connected to the well-being of our communities. And if we do not realize that and pool our resources and have everyone represented at the table, our community will not be well.
Let's take on the sobering thought that this takes less than an urgent priority. If we're not able to, and this is not to deny the hope, but I just want to paint the picture of, if not now, what would be the consequence?
You would continue to have these disparities. You would continue to have people, certain groups of people not getting access to, let's say, an interventional procedure at a hospital. I mean, we know from studies that certain groups of people, even if they have the same symptoms as someone else, are less likely to get an interventional procedure. We know that Blacks are more likely to have an amputation as compared to whites. We know that hypertension rates, diabetes rates, obesity rates are higher in certain communities. So if you know all of that, then we also have to understand how neighborhoods are built, how certain businesses get authority to come into certain areas? Why are there more liquor stores in Black neighborhoods than white neighborhoods? Why are there more convenience stores in Black neighborhoods compared to true full service grocery stores? So, if you have a neighborhood with only convenience stores and not access to fresh food, then you're probably going to see more hypertension rates, more diabetes rates, et cetera. So again, all of these things are related. Why are certain Black neighborhoods or Hispanic neighborhoods less likely to have sidewalks? So if you're less likely to have sidewalks, are you going to walk to the nearest place instead of drive? Probably not, because there's no easy pathway to do so. So again, all of these things are connected, and we have to, as a citizen, as an advocate, be at the table to have these discussions.
Absolutely. Thank you. And at the table, of course, with food insecurity as a part of the dialogue. So we're fortunate to have all of you here in this panel and in the conversation. What about us as individuals? I know we are talking about what people need. We are talking about the challenges that people and children and their circumstances create. When we're as individuals facing these things, what is your recommendation of one, how to be a part of the change, but also to, I guess, get off of this ride that we're talking about onto that place of thriving, prosperity, and hope? Kristen, I'll start with you.
Sure. Well, I think each person as an individual, no matter what their situation, should become an advocate. And both Mr. Johnson and Dr. Hooks talked about a little bit about advocacy. And what I'm thinking specifically about policies that impact food access, right now, the COVID relief bill that is being debated right now in Congress, there are a lot of safety mechanisms that would help families access food. It includes a provision to extend the increased SNAP benefit of 15%. It includes increased WIC funding, and we don't know where that bill is going to go. And I think everybody on this call, spread the word, make calls to your congressperson. And there's also recently President Biden signed an executive order, I think 2 days after the inauguration, that called for the USDA to basically provide guidance to states about expanding SNAP benefits and providing an increase in pandemic EBT to help families with school-aged children. And these safety net programs are really, they're beneficial to those that are enrolled in them. And they help our economy. For every dollar that's spent in SNAP benefits, that triggers $1.50 to $1.80 of economic activity in our country. And so it benefits everybody to have those safety nets in place. And it also adds dignity and allows for families to use resources that are made available to them, so they're less likely to have to rely on a food pantry.
Excellent. That makes excellent sense. Was there, did either of you, Dr. Hardin-Bartley, Gerald, Dr. Hooks Anderson, want to speak on the individual, speak to us, or have an invitation to create, be able to embrace or affect some change? I know one of my struggles, if I may, is that you can get so overwhelmed by the information, or you don't feel that you're making the progress you could or should. What are some things that any of you would encourage as well as for an individual?
Oh, I'm happy to tackle this one. So if you look at a lot of the major movements within our country, like if you look at civil rights, or just other major movements, they were ground up. They were not necessarily from above down. It took the people, the community, to organize and say, we demand this. We demand this for our constituents. And then that caused our our leaders to then move. So yes, if you look at the big picture, sometimes it can be overwhelming. The disparities are real within our communities, but it takes us individually to come together, and sometimes the come together may be within our own families. So within our own families, to have those conversations about, you know what, guys, we're going to eat better. So we're going to make some decisions about how we're going to prepare food. We're going to exercise. We're going to make these changes within our own families. Then we're going to spread that to our extended families. Then we're going to work on the people in our neighborhood. And you know, we notice that in our neighborhood, we don't have access to certain grocery stores. So again, it's then talking to your alder person, then talking to the aldermanic committees, then talking to your school district. So there are things that we can do as an individual where our circle keeps getting bigger and bigger and bigger. And then you join in partnerships with the AHA, with the ADA, and all these other groups, like the Operation Food Search did, how they, you know, partnered with the Urban League. So there are things that we can do, and then we spread our wings so that we work more effectively. I just don't think there are times that we get overwhelmed, like you said, Jade, and we don't see the power that we have. We have power. Our legislators, they work for us. And we have to remind them that they work for us. And we can make these changes if we're all, you know, collaboratively using our collective voices for these particular issues.
Yeah, Jay, the only thing I just want to build on, because there's really nothing to really add to that other than the importance of being informed. One of the things that I've learned in this job, and it humbles me daily, is what I don't know. And so when you think about civics as a headline, the power to drive change starts local. And so everything that you just heard is exactly right. But being informed, being knowledgeable, and also being aware of history, because that saying is true. If you're not aware of it, you will repeat it. And all we're doing right now in 2021 is repeating something that happened 10, 20, 30, 40, 50, and 100 years ago, because we've never understood it. We don't realize how deep it is and what it's going to require for us to change it. And so that knowledge thing, being informed, being educated on what's really happening, and not just falling in love with speaking out on the symptoms, but the root causes of things. You know, the symptom to me is like us taking aspirin for a headache, right? We want the headache to go away, as opposed to saying, wow, what's going on with my body that's creating these headaches in the first place? And so this work is like that too. The more knowledgeable we can get about what's really going on, and then what can I do to that point? If you can't do everything, but a few things at a time, I think it's spot on.
Absolutely, Gerald. Absolutely. And what encourages me with that is by having that knowledge, then we are empowered and feel more empowered and confident that when we ask and say we have a need, that will be responded to, because we're not coming timid or uninformed. We have scientific data, we have a valid position, and we have the support of our community to see those differences happen. Oh, you've got something started here today. This has been fantastic, and the conversation tremendous. I want to go back around and have your final thoughts. I'll start with you, Sharonica.
If we truly want all of our children to be well, it requires a collaborative and cohesive approach so that we can, in fact, ensure that. So
Tell
join,
us where you need us,
support
Dr.
us.
Hardin Bartley.
Just reach out. I don't have enough time, but we want to say that all of our children are well, and school districts can't do it alone. Thank you, Operation Food Search. We love our partnership with you.
Yes. Kristen, we'll pop to you.
Yes,
since
well, I would
you're-
like to say ditto to Dr. Hardin. I think it really just takes people coming together, looking for ways to partner and collaborate. And, you know, in many cases, starting with the youngest in our population, because, you know, their childhood can often set them on a path. So I think we need to help a lot of folks, but I have a soft spot for children in particular, but I think it takes collaboration and partnership.
Absolutely. And where do you need us, Kristen?
So that was just me.
I got it. I was saying, where do you need us most?
Oh,
yeah.
yes,
How
yes.
can we rally up and be partners with you too?
I would encourage people to, actually, I just put in the chat box to follow our policy team on Twitter at OFS Food Advocate. And I would encourage people to go to our website. We have a new revamped website that is being launched tomorrow, and learn more about our volunteer opportunities and ways to get involved.
Excellent, excellent. I'll circle back around to you, Dr. Hooks Anderson, and finish with you, Gerald, for your final thoughts. Dr. Hooks Anderson.
I would just want to remind people that, health disparities are real, that structural and systemic racism is, unfortunately, that it's embedded within our culture, and that in order for us to address these issues, each of us, will need to be advocates, and, find something that you feel passionate about, and, join in the fight, because it's going to take all of us individually banding together to make these changes. But I often, whenever I speak to different groups, I like to talk about a legacy of wellness. And in order for us to be able to have this legacy, we have to make some individual changes, some family changes, community changes, and our nation needs to change. And so we each have a responsibility in that.
Gerald.
Yeah, I think the only thing I can add to everything that's been said is that in order for great change to occur, we personally and we collectively have to be willing to sacrifice. And I would just say to you, if you're comfortable with what you're seeing and what you're doing, then you're not the one that's going to help drive this change. We have to get uncomfortable. We have to get tired of being tired and move to a place of whatever I did yesterday isn't enough. And what could I do with others to make this better for those kids, for those seniors, for those communities? Because in as much as we refer to numbers, we're actually talking about real people. There are brothers and sisters and friends, and there are people behind these numbers that I don't think we feel the way we need to feel. So we got to be willing to sacrifice. And if you're comfortable, I would say that you're not really in the game yet.
Mm-hmm. That is most certainly the sentiment. And if that doesn't rally you, we will be happy to repeat it for you. What a fantastic conversation, everyone. Thank you, all of our panelists, for sharing your expertise today, as well as your passion and perspective. On behalf of the American Heart Association, we look forward to continuing to collaborate with each of you to extend people's lives today and into the future. To that end, there are always ways that you and your audience can stay engaged with the American Heart Association. Let me give you a few. Connect with the AHA online at heart.org. If you or someone you know are needing support through their heart disease or stroke journey, be sure to connect to our online support network. Stay up to date with local activities on all of our social media channels. Find them on most all platforms with at AHA Missouri, and be sure to stay tuned for future webcasts and learning opportunities. I can't wait to sign up. Our next community conversation will be in early March on the topic of the COVID-19 vaccine. So thank you again for our panelists for that dynamic conversation, and we thank all of our attendees for your attention and engagement. Thank you to our local sponsors of today's webcast, BJC Healthcare and Missouri Department of Health and Senior Services. Thank you so much. It's been my pleasure to moderate today. You can find me at Mrs. Jade Harrell, and this brings this community conversation to an end. So I will leave you with this until next time. Stay safe, stay healthy, and stay connected. Take care.